Does damage to the nerves in the brain mean that you will never regain arm movement? If you've had damage to your brain and you're in the recovery process, yet you have spasticity or contractures, does that mean you're never going to regain arm movement? If you've been asking yourself these questions, you are in luck because that is what we're going to go over today. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, mindset in the context of someone who has had damage to their brain or their spinal cord and they're in the recovery process, with the end goal of empowering you with as many tools as possible to reach your highest functional level. And all that being said, today we are going to talk about shoulder movement. If you've been following along, this is the third installment of a 3-part series where we have been slowly building the right tools for you to be able to critically think through your own arm impairments and build a program that will move you a little bit further in your shoulder movement recovery. Now, quick recap. In last week's video, I went into all the bones or all the components that need to be able to move in order to achieve overhead reaching. That discussion involved talking about the scapula, the flat bone on the back of the shoulder, the thoracic spine, and some of the movements that this arm bone needs to have in order to be able to, again, achieve that overhead reaching. If you haven't watched that video, it's critical to watch that video first as kind of a prerequisite to kind of understand what's going on or what I'm talking about in this video. Some of this might be a little bit confusing if you haven't watched that video. So I put a link for that video in the description below. Stop this video and go back and watch that video first, and then this video is going to make a whole lot more sense. Or if you prefer, I also mentioned in that video that I am giving away a free shoulder course where I include the exercises with the rationale from last week's video with some additional exercises. So I just showed a few different categories of exercises in last week's video, but in the shoulder program that will be emailed directly to you if you sign up, it's a little bit more comprehensive. So link to sign up for that is also in the description below. But now that we got all of that out of the way and we've caught everyone up to speed that is joining us in this video for the first time, that will again catch you up to speed. So now, what is the next step in this series? And that is movement, not just the arm movement. Now, I talked about 2 different visuals that you need to have, standing way back and looking at what the arm does, but then also zooming in and looking at what each little component motion is that contributes to overhead reaching. So if you haven't already figured it out, shoulder motion, especially overhead reaching, is extremely complicated and there's a lot of moving parts. And the bottom line is that perfect overhead shoulder reaching requires a very coordinated effort of muscles working together to move all of those bones in a coordinated fashion. And I've used this example before, but it's worth repeating that normal muscle synergies are absolutely critical for us to do those everyday normal movements. And as we do normal movements, we actually do develop muscle synergies where muscles link up. I use the analogy of kind of music, and there's only so many notes, but depending on how you put those notes together, that's how you create beautiful songs. Same with movement. Movement is this perfect balance of muscles, individual muscles coming in at the right time, exiting at the right time, having their own kind of strength or power. All of that matters in order for us to produce smooth, rhythmic movement. And the shoulder is probably a prime example of how muscles need to work together and kind of create this, sticking with the same analogy, this symphony for everything to be efficient as far as each muscle needs to be efficient, and that all depends on where these bones are located and how they are assisting in moving through this motion. So In an effort to keep things simple, and really because I don't think it's accurate to address specific muscles, we aren't going to go that route, but we're really going to talk about the most important movement patterns that I think, in my experience, are the ones that are the most limited. And occasionally I may throw in, you know, these muscles are typically overactive and these muscles are typically underactive. But if you don't really understand that component of it, long story short, that really doesn't matter. So the movements that I think are the most critical are thoracic extension. I talked about that in last week's video, and it is dependent on where the arm is at. So thoracic extension, in the context of shoulder reaching and where it's important, is when the arm is starting to reach what we call like its end range. So in my opinion, you kind of have to work thoracic extension with the arm in that position. So when we get to the exercises, that's just to help you understand why my arms are positioned the way they are and why that's important. The other motions are that shoulder blade, and again, the position of the arm bone is really important when you are working these shoulder blade movements, because the shoulder blade has to move in different directions depending on where the arm bone is at. So really pay special attention to how I have the arm bone positioned when we're doing some of the shoulder blade kind of movement retraining exercises. So, for example, scapular upward rotation is a movement that the scapula needs to be able to do, or the shoulder blade needs to be able to do. But that motion starts to happen once the arm is away from the side a little bit. So that is the position that we're going to do that in. The scapula starts to tilt backwards, and I talked about posterior tilting in last week's video. So definitely go back and watch last week's video, but that starts to occur when the arm's a little bit closer to what we call end range, so a little bit higher up. So that really is important as far as that when we start doing that exercise, having that arm up high. Now, it's important to mention here, because this did come up in the comments this week, that I'm fully aware that some people aren't going to be able to get into these positions, depending on how much spasticity you have, how much muscle shortening you have, how limited your range is. But there's also a lot of people that watch this channel that are on the higher end of things, or like more advanced. So that is why I give the advanced versions. If you're working with a therapist, that is our skill. That is our job, is to be the one to constantly be thinking critically and using our clinical decision making to figure out how to modify an exercise or what stretches to do with you in preparation for an exercise so that you can get in these positions. So I get really frustrated when I have patients tell me that, well, my therapist says I can't do that. Well, can't or just not yet. I think there's a difference there. And I hope that most therapists are thinking, just not yet. What do I need to do to bridge the gap between where we are now and where we're going to be? But that's just a little tangent. But definitely, where there's a will and some creativity and some positivity, there is a way. So the other critical motion is, of course, shoulder flexion, getting that arm up, because that is what we're working today. But again, because we're talking about combinations of movement, shoulder flexion with external rotation. You have to be able to externally rotate your arm in that overhead position. At the very least, you're going to have pain in your shoulder, but worse than that, you may never achieve full shoulder flexion, overhead reaching, arm by the ear if you don't also work on that external rotation. So that shoulder flexion and this arm bone externally rotating is also a critical combination of movements that we will address in the exercises. So again, I use a dowel rod, I use tools a lot. If you downloaded The stretching shoulder program, you know, I mentioned that in that video as to how critical the tools and some of the props that I use when doing the stretches is. It's equally important when we're doing the movement retraining. So in a minute here, I'm going to show you some of the exercises that I think are the most important or the most limited, again, in my experience with the patients that I see. And then when we come back after I show you the exercises, then as promised, I'll get into spasticity and abnormal movement patterns just a little bit more in depth and kind of tell you or give you modifications to do based on some of those impairments. So again, it's worth repeating. If you haven't watched last week's video, you might not know what your movement impairments are or what contributing factors might be limiting your ability to move. So if you haven't watched it, go back and watch that video because it is important to kind of know your exact kind of movement problems so that you know how to modify the exercises. But again, here are what those exercises are. This is isolated shoulder elevation without the associated elbow flexion. So this is for anyone who has strong flexor synergy patterns or strong synergy patterns in general in the upper extremity. The dowel rod is here to keep the arm extended as you raise those shoulders up. So a lot of times when people shrug their shoulders, their arm wants to pull up and flex up in front. So the dowel rod is just keeping that arm straight and keeping that arm down so you can just isolate that shoulder elevation. So what we're working on this exercise is thoracic rotation. So the critical component to this is rotating that thoracic spine with the arms in this position. Now I know for a lot of you it's going to be really hard to get a dowel rod on your shoulders behind your head. Eventually you'll get it. Just keep stretching that arm out. Eventually you will be able to get a dowel rod behind your back. I do have something, I'm not really sure it's worth the investment for this one exercise, but I do use a curved bar like this occasionally with people because it does allow the bar to come a little bit further forward without your arm dropping forward. So you could hold the dowel rod in front of you, but a lot of you aren't going to be able to hold your arm up there. So I'll put a link for this bar here. Again, I think it's like $40. I'm not sure it's necessarily worth it for this one exercise, but it does make it easier to get your hands in this position and hold them in this position while you do that rotation. That's the critical component for this exercise. But again, I'll show it to you with this bar. You're just rotating that thoracic spine. So for this exercise, what we're working on is kind of that end range of shoulder flexion, really isolating some scapular movement. So at end range, that shoulder blade should really kind of rotate upwards and externally rotate just a little bit. So it should kind of tip backwards just a little bit. Definitely use a elbow immobilizer, especially if you have spasticity in the bicep, to prevent that arm from trying to bend in, which is extremely common. And also strap your hand to the dowel so that you're not having to think about keeping that hand on the dowel as you do this exercise. And then again, working that end range movement. So you're trying to think about squeezing those shoulder blades together as you try and get that dowel as close to the mat as possible. You want to try and get them pretty even. So if you find that your uninvolved arm is getting all the way to the mat and the involved arm is not, just keep working at it. Progress is progress. So just getting in this position and not even doing anything, just letting gravity kind of allowing that dowel rod to go backwards is a great stretch. So added bonus is if it starts to move in that direction, just kind of move with it. So let me show that to you again. Laying on your back, knees bent up for this one. You're just bringing that dowel rod back towards the mat, trying to Squeeze those shoulder blades together as you get it back there. Now, if you find that it's really hard or the arm is really trying to pull in or bend up in that elbow mobilizer, think more relaxed and just kind of let the weight of the dowel rod just kind of move your arms back, and then at the very end, try and squeeze those shoulder blades together. That would be a good starting point, especially if you feel like your arm's really fighting this movement. And bring it back up, and then try that again. Squeeze those shoulder blades together as it goes back towards the mat. And again, squeeze them together as it goes back. So for this exercise, what we're working on is just a very small movement at that kind of close to that end range of overhead shoulder reaching. So you'll notice that most of the movement that we do in this exercise is really past shoulder height. You want to do this one laying down, but we're literally just working on raising those arms up past shoulder height without that elbow kicking out to the side. That's why the setup for this one is really critical. And then it's just a very small movement. Now, if you find that the arm is really trying to rotate in, or that the whole Pilates ring is rotating in the air, try and work less. You do have gravity assisting you a little bit with this. And what we're really trying to do is really kind of inhibit or decrease any spasticity that's in that lat, which is one reason why that arm kind of pulls in and why that elbow kind of jets out to the side when you try and lift your arm up. So if that's happening, think more relaxed, work less. A lot of times I see people working way too hard, and that just makes that spasticity a lot worse. So I'm going to show that to you again, laying on your back, elbows bent and strapped together so that they're staying in. And then it's just a small movement. You're just going from here to here, here to here. You're using gravity, allowing gravity to assist that movement. So for this exercise, what I'm doing is just squeezing those shoulder blades together. The arm position is really important in this one. So if you can get your arms behind your head, that is the preferred position. If not, just kind of getting them in this position is okay to start with, but you really want to try and aim for this position, and then you're just pressing those elbows back towards the mat. You can see I am laying on a little peanut roll here. That's just to give my shoulder blades a little bit more freedom to move in this position. So again, arms behind the head, and then you're just squeezing those shoulder blades together. I'll show that to you again. So for this exercise, what we're working on is getting that shoulder blade, that flat bone on the back, to kind of rotate upwards with the arm overhead. That's when that shoulder blade really needs to be able to rotate upwards, is with that arm in that position. It's a small movement, but it's really just that shoulder blade, that bone on the back, moving upwards in that direction. So that's what you're focused on, or that's what you should be focused on for this exercise. So let me show that to you again. So arms supported on something with wheels on it, just to make it a little bit easier. And then you're just pressing up. So you're bringing that shoulder blade down, then you're just pressing it up. It's a small movement. You're just isolating that shoulder blade motion up in that direction. So for this exercise, what we're doing is using a TheraBand to just move those arms apart. Now, when you move those arms apart, you really want to think about squeezing those shoulder blades together. I do recommend doing this with an elbow mobilizer on, just to prevent that arm going into some kind of a spastic pattern when you try and do this movement. I always recommend starting with the easiest TheraBand possible, and to do this one laying down. That will just help you to keep that shoulder blade in position as you perform the movement. Now, as far as holding on to it with your involved hand, just play with it, mess around with it. It just depends, kind of, everyone's wrist kind of bends in a little bit of a different position if you have spasticity in your wrist and in your forearm. So, I mean, just wrap it around a couple of times until it seems like it's not going to move, and then you're just going to press outward. So, laying down on your back, just pressing those arms out. I'm going to help it to vertical and then allow gravity to help. And then use your other hand to bring it back down. And then again, you're going to assist it with your other hand to vertical. And then allow gravity to assist you with the rest of that motion. So I hope all of those categories of exercises make sense. Now let's talk about what you need to do or what you need to be thinking about if you have spasticity or abnormal synergy patterns. Now, the most common kind of movement problems that interfere with normalizing movement are spasticity, in particular in the bicep. So that's, you know, you have that if your arm just involuntarily flexes up. Now that's different than if your arm just stays flexing up. That's most likely a contracture. But if you notice that your arm is involuntarily, your elbow is just involuntarily bending, then that's probably spasticity in your bicep. So we're going to call that like an overactive bicep. And that usually is combined with a flexor movement synergy. So what happens is when you go to overhead reach, you go into that flexor synergy. And again, I talked about that in the first video. It's an abnormal movement pattern that happens as one of the stages of the movement recovery process. And some people just get stuck there and that becomes ingrained. So every time you go to flex your arm up, you're going to get all this combination of movements that occur, including a little bit of elevation and a little bit of retraction of the shoulder blade and abduction. That's usually the critical one. So when you go to lift your arm, it kind of looks something like that. That's a combination, in my opinion, of a little bit of biceps spasticity or spasticity in the biceps and a flexor synergy pattern. So what do we want to do is we want to isolate shoulder flexion without all of these movements coupling together and without an overactive bicep. So I usually recommend that when you're working on shoulder flexion that you use an elbow immobilizer. Again, we're trying to uncouple this abnormal muscle coupling. Now, side note, this isn't part of this video and it's probably not contributing to shoulder movement, but in most cases, people also have a lot of spasticity in the wrist muscles, keeping that wrist flexed. So if you do have a splint, again, we just want to kind of quiet down overactive muscles in general. Not a bad idea to just put your hand splint on as well. A lot of times, you guys have seen it in other videos. If you've been watching for a while, I use an air splint. The air splint's really good at kind of giving some deep pressure to the arm, which can help to quiet some muscles down, as well as the fact that the one I usually recommend is long, so it goes down past the hand and it'll actually also keep the hand open. So I will put a link for that air splint in the description below, especially if you don't have a hand splint. I do recommend the air splint just to kind of help quiet down those wrist muscles as well while you're isolating shoulder movement. So that would be my suggestion for any of the exercises where the arm needs to stay straight. The other very common problem, and you might have this in addition to what I just talked about, but also very important, is some spasticity in the subscap and the latissimus dorsi. That keeps the arm really glued to the side. and internally rotate it, and keeps that shoulder blade downward rotated. So to kind of get those muscles out of the picture, that's why I showed some of those exercises laying down on your stomach. It's just a better position so that those muscles cannot be as active. Again, we want to uncouple those muscles because we want the latissimus pretty much kind of quiet as much as possible when we are trying to achieve that overhead reaching. So I really recommend the ones on the stomach. I did show some on the back as well, just because I know some of you can't get on your stomach, but if you can, for the exercises that I showed on the stomach, if you don't have the range to get your arm in that position, if you have a mat table, which is a firmer surface, I recommend kind of putting it a little bit higher and setting a chair or something a little bit lower next to the mat and starting just with your arm a little bit further down. So most of you will be able to do that. It's just that you don't have the range to get your arm in that position. In addition to all the stretches that I showed last week, it's super duper important. So make sure that you're not just moving right on to the movement retraining, but that you're also starting each session with the stretches, mobilizing, set yourself up for success, make sure the bone can actually do the motion before you start asking muscles to actually do the motion for those bones or to pull on those bones correctly. You first need to make sure that they can passively do that motion. And then the other huge problem that I see that is extremely common, I would say like in 80% of the patients that I see that have had a stroke, brain injury, or MS with a lesion in a part of the brain that controls the arm, is scapular winging. So remember last week I talked about that external rotation of the shoulder blade, where the flat bone, the outside edge kind of rotates backwards and the inside edge goes down, and how critical I said that movement is. Well, in a lot of cases, there are so many muscles that pull that shoulder blade into internal rotation that are overactive. The pec major, the pec minor, as well as weakness in the serratus. All these muscles are contributing to that shoulder blade kind of tipped in the opposite direction. It's real easy to see this on yourself or have someone take a picture of your back, and you'll see that one shoulder blade is kind of sitting off of your back a little bit. So it's really important to keep working on that shoulder blade external rotation. The stretching is so important. And the other reason that this happens that's worth mentioning is a very inactive serratus muscle, which is a muscle that sits in between the shoulder blade and the ribs. And so it's important to mention that you might hear some kind of crackling or bones kind of rubbing on each other. That's really just the fact that that muscle is probably atrophied a little bit, and so it's really the shoulder blade that you're kind of feeling kind of rubbing on the ribs a little bit because that muscle's not there. So if you don't feel it on one shoulder and you feel it on this shoulder, that could be why. So definitely important to just be aware of that and know that you're probably not breaking anything or damaging anything if you do that. And also why it's important to do some of the prone exercises on the elbows that I show in the exercises. Really important to strengthen that muscle and ultimately to restore normal shoulder motion. And then that is it for this video. I hope you guys enjoyed this series. I hope that all made sense. Definitely keep leaving your questions in the comments below. It definitely helps me not only to plan future videos, but it really does help me to keep learning and growing in my communication style, because sometimes I think I explained something correctly and then someone will ask a question in the comments and I will go back and listen to it again and realize that I kind of missed the mark on explaining that correctly. So definitely keep leaving your comments. Also keep responding to each other's comments. I love seeing that down there, how you guys encourage each other. So I really appreciate all of you that have been around here for a while, and you're kind of part of the team now and how you support others who are newer to this community. As usual, if you are new and you haven't yet subscribed, hit that subscribe button and turn on that notification bell so that you'll get notified every time I upload new videos. I enjoyed spending time with y'all today, and I will see you in the next video.